If you have sciatica, this might be the surgery that you need. This is how we do decompression surgery for your lower back. In order to do the surgery, we position the patient flat on their stomach and we prepare them in a standard sterile surgical fashion. Before we make our incision, we obtain an x-ray in order to confirm that we're performing surgery at the correct level. We then make an incision at the midline component of the back and we place our self-retaining retractors. We then have to move all the musculature out of the way, and this is done by something called blunt dissection, or it can be done through electrocautery dissection. Once we identify the correct level that we're going to perform surgery on, we begin by removing some of the bone in the back. This includes things like the spinous process as well as a structure called the lamina. This is why the procedure is called a laminectomy. Here we remove the posterior component of the vertebrae while trying to preserve the articulating facets on either side. If these joints are affected, it could potentially destabilize the spine, which would require further surgery. By removing the posterior component of these bones, we actually create more space for your nerves. And that process of removing the bone and creating more space is called a decompression, otherwise known as a laminectomy.